Hello, welcome to the Fit to Be Girls course. My name's Jacob Mears. I'm a certified nurse midwife at the WellCare Medical and Behavioral Clinic in Reno, Nevada. I am so very excited about this course, and when Beth first asked me to be part of it, I jumped at the chance. Part of the reason that I'm so very excited about this course is that I'm the father of 3 little girls. And I really hope that they're able to participate in this course and learn about how their bodies work and why they do all the wonderful things that they do. Another reason that I really am excited about this course is that throughout the course of my typical day, I talk to so many women who quite honestly were just never given good information about what their bodies do and why they do it. So hopefully by now you read the article that I wrote in which I talk about what to expect at that first visit, what the exam is going to be like, if there is an exam at that first visit. I went over what your rights are as a patient. Talked a little bit about what are some of the abnormal things that you might want to watch for, reasons to make an appointment sooner than scheduled. Talked a little bit about how to find a good provider and find one that really works with what you want as a customer. I am sitting here in my actual exam room, or at least one of them here in Reno, and I wanted to show you a little bit about what it looks like inside one of these exam rooms and some things that you may see during that first visit. So you may notice I'm sitting in front of my exam bed. This is a very typical exam room bed you'll find just about anywhere in the country. You'll notice that it has a pull-out part here, has these foot holders here. I don't know if those are going to show on the camera. There's one right there. I refer to them, by the way, as foot holders. They're not stirrups. You are not a horse. And there are drawers down here that hold various things for me throughout the exam. Now, let me show you a little bit about what you might expect. After you get checked in, my medical assistant will get your height and weight, ask you a bunch of questions, and then she'll take you into the exam room and give you one of these lovely gowns. Now, to be honest with you girls, I am not crazy about the paper gowns. This is what the company that I worked for happened to buy. I'm really trying to get rid of them because I think they make people feel a little more vulnerable and, well, like you're naked underneath a sheet of paper, which you are. But anyway, you're going to come in and you're going to put this gown on. This goes open to the front, which sounds very, very strange to most people. And it's going to sit kind of like this. I'll have you come sit up on the bed like this, and there'll be another drape that goes over your lap like this to kind of preserve your modesty. At this point, we'll start the exam, and I'll usually work head to toe, and you'll see me, I'll come in here and I'll feel your lymph nodes, I'll feel your thyroid here, I'll take a listen to your heart and your lungs, do the very first part of the breast exam with you sitting up, and then I'll have you lay back. Now, here's where I deviate from a lot of what most people do. Most OBGYNs and midwives will have you put your feet, if I can find them, in these things, these lovely foot holders right here. These work kind of like this. You put your feet up here, scoot all the way down to the end of the bed like this, and we do the exam like this. Personally, I don't use them unless I absolutely have to. I don't like them. I don't think they're comfortable. What I prefer to do is slide this table out and have women sit like this, then bring their ankles together and drop your knees to the side like that. Seems to be a lot more comfortable for people. Certainly doesn't stretch your hips way out of joint like the foot holders do. And I do my exam that way. Now, let me get rid of the gown. During the actual exam, I want to show you some of the things that I guarantee you will see in just about every GYN exam room throughout the country. Probably the most famous one is this guy. This is a vaginal speculum. This is what is used to go inside of the vagina so that your cervix can be seen. Now, I've got a plastic model. It's not the best, but this is a basic plastic model. You can see urethra here, vagina here, right? Uterus here, fallopian tubes and ovaries here, and the rectum here at the bottom. The speculum goes in like this, and then the distinctive click sound, and then I can visualize your cervix. Now yours isn't split in two like the model's is, hopefully, but that's what we're doing with that speculum when we insert it. Now the speculum itself is lighted so we can see what we're looking at. The light just goes in there. It's kind of hard to see on the video, so I left it out. Now these speculums, they come in plastic and metal. I prefer the plastic ones. That's the only kind I use in my clinic. I find they're more comfortable for people. The metal ones have a little screw here that tends to trap hair and skin and pinch people. Not my favorite. Now, once we have the speculum inside, this is what we're doing. This is called a cytology brush. Okay, a cytology brush goes inside the cervix, just like that. Takes some cells out from the very inside, around the os, which is the opening of the cervix. And that goes in this little container here. Following the cytology brush, we'll use this is called a spatula, to take some cells from around the outside. Also goes in the same container. This little container goes off to a pathology lab, and they tell me whether the cells that we collected were normal or abnormal. That is really all there is to a Pap test itself. Now, hopefully, people are going to start seeing their provider before they're 21, and you won't need a Pap until your 21st birthday. In fact, if somebody comes to see me and they've never had a Pap and they turn 21 next month, I will say, great, I'm glad you're here, let's do an exam, and then we will do a Pap next year when you're 21. Now, the speculums come in several different sizes. The white-handled one that you saw, this is a small. I use a small for just about everybody. If I can't possibly get away with a small, I'll use a green-handled speculum, which is a medium. They do also come in a blue-handled model that is large. I think I've used a large one maybe 3 or 4 times in my entire life. Almost never use the large. It's huge. Now, when somebody comes in for the first time, and they're really nervous and they know they need a Pap, let's just say you are 21 and this is your first visit, I may set up appointments where, our first appointment, we're just talking and there's no exam involved. And if we're able to do that, and a lot of that, honestly, I wish the world weren't the way it is, but a lot of that is dictated by insurance. It's terrible, I know. But if you're able to do that and just come in and talk that first visit, I will typically send you home with one of these. And what I want people to do is just get familiar with it. Get used to that click sound that it makes. Realize that this is a piece of plastic. It's not scary and it doesn't have to be. That way, when you come in for your first Pap, you're already familiar with what things are going to look like. I do use other things to teach. I have great models like my pelvis here. I like to explain where the muscles go, where they insert, what they do to support your pelvic floor. I actually have a little baby model that passes through the pelvis. If someone's pregnant, I can explain childbirth that way. But this is really what every exam room in the country just about is going to look like that first time you show up. Now, if you get home and you think, oh man, I really want to ask about whatever, hopefully you have that relationship with your provider that you can ask these questions. But if not, find me. I'm on the Fit to Be Members Forum. Feel free to shoot me a message anytime with any questions that come up. I'm happy to answer them. Thank you for watching, and I hope you enjoy the rest of this wonderful course that Beth's putting together. Bye-bye.